name is Keegan Doherty, and I'll be talking today about the difference between a myocardial infarction and a cardiac arrest. So you may have heard the expression serious as a heart attack, and that means that something's very significant, but even more serious than a heart attack is actually a cardiac arrest, which has vastly different outcomes. So these conditions both involve the heart, but are actually caused by different etiologies, and from there have significantly different outcomes for patients. A myocardial infarction is another name for a heart attack, also known as an MI, and it has two primary causes. The first is coronary heart disease, and with this, there's an issue with the flow of oxygenated blood to a certain part of the heart muscle through the coronary artery, and it becomes blocked due to ischemic heart disease. So this really involves a buildup of atherosclerosis in a given part of the artery, and so just a buildup of plaque over time that eventually can rupture, forming a blood clot that actually blocks blood flow to the artery, and this forms on the surface of the plaque in that area. And so if the clot is sufficiently large, it just blocks the artery entirely, which causes necrosis of the heart muscle from that point on in the artery. And from there, the heart tissue actually dies through the necrosis and becomes scar tissue, which leads to heart damage, and that impacts cardiac functioning long term. Another cause of a myocardial infarction, less common, can be a coronary artery spasm, in which the coronary artery literally spasms and it cuts off blood flow through the artery. And this can occur even in parts of the coronary artery that aren't impacted by atherosclerosis or any plaque. So it can happen in a much broader range of people. And this can be caused by drugs such as cocaine, or an extremely cold situation, cigarette smoking, or pain, and it can even be caused by emotional stress. Cardiac arrest is also typically caused by coronary heart disease. 70% of cardiac arrests actually have that as an underlying cause, but other cardiac issues can also lead to cardiac arrest, such as congestive heart failure, pulmonary embolism, left ventricular hypertrophy, congenital long QT syndrome. It can also be caused by a drug overdose, an electrolyte imbalance, usually pulmonary embolism, or trauma. Fundamentally, a cardiac arrest is caused by a sudden cessation of cardiac activity, so the heart isn't able to adequately beat, which then leads to a stop of the heartbeat and also the respiratory system. So this can be caused by VFib most commonly, which is where the lower ventricles do not beat properly and instead quiver in like a rapid and irregular manner. It can also be caused by pulseless ventricular tachycardia, pulseless electrical activity, or asystole, in which there is no heart rhythm at all. The common cause of death in the United States is coronary heart disease, which is a big precursor to myocardial infarctions. And there were 605,000 new myocardial infarctions every year, and there are 200,000 recurrent myocardial infarctions every year. And in 2015, there were 151,863 death certificates that listed myocardial infarction as at least a contributing factor to the death. So the average age of the first myocardial infarction in men is 65.6, and for women it's 72 years of age, and MIs are much more common in men than women. Cardiac arrests affect 400,000 Americans every year, and there's a peak of sudden cardiac death between birth and 6 months of age due to sudden infant death syndrome, or SIDS, but then there's typically low incidence in adolescent and young adult years until the age of 45 to 75, when there's another peak. And so interestingly, there's the same etiology of cardiac arrest in young adults as older adults, with up to 70% actually involving underlying coronary heart disease. Infarctions impact the coronary arteries of the heart and are solely caused by issues within the heart that block blood flow, whereas cardiac arrests impact the heartbeat itself, typically the ventricles, and can be caused by issues in other parts of the body. So trauma to leg that causes a lot of blood flow, even if it's like a stab wound to the leg, could actually lead to a cardiac arrest. Symptoms of a myocardial infarction, or MI, are chest pain, which usually retrosternal and radiates to the arm, or also causes mandibular pain. And this is usually characterized by like a heavy pressure or crushing sensation in the chest. You can also have sweating, nausea, abdominal pain, shortness of breath or dyspnea, and syncope. These symptoms actually appear differently in men versus women. So men are typically seeing the like crushing, intense chest pain that you characterized myocardial infarction to have, whereas women often have more of a feeling of general illness or malaise. So it's like nausea, vomiting, and shortness of breath, and actually back pain instead of chest pain. Cardiac arrests are very straightforward, so this is a cessation of the heartbeat, so there will be no heartbeat, which also leads to a lack of breathing, so just a complete loss of pulse and no breathing. But just before cardiac arrest, patients report having like a racing heartbeat or feeling dizzy, and up to an hour before the cardiac arrest, people often have chest pain, shortness of breath, and nausea. Infarctions are diagnosed through EKGs, biomarkers, and a cardiac MRI typically. So the EKG is usually a 12-lead electrocardiograph, and it's used to detect acute coronary syndrome. So this can be performed usually within 10 minutes of arrival to an emergency department. And you're looking for ST elevation or depression, and it's based on how many millimeters this is in difference. You can also look at T-wave amplitude, which is an earlier indicator of ischemia. The marker you're looking for to indicate a myocardial infarction is a troponin level. So this is a cardiac enzyme that will be elevated in cases of MIs, but it doesn't differentiate between ischemic and tension-based MIs. A cardiac MRI can be used to see the myocardial structure and function. So this can be used to determine the myocardial perfusion, viability, and thickness following a heart attack. On the other hand, require very little diagnostic testing given how evident the condition is. So there can be point-of-care testing used to determine potassium and blood glucose levels, and a cardiac ultrasound can also be used to look for cardiac activity, but beyond that, it's very clear based on the lack of pulse and breathing that someone's having a cardiac arrest. Major treatments of MIs are percutaneous coronary intervention or an angioplasty, the administration of an intravenous fibrinolytic agent, and just various medications that can be given orally or intravenously. So a PCI is the percutaneous coronary intervention, and this is when a stent is placed through a catheter into usually the femoral artery, and then guided up into the heart, where it actually can press the clot up against the walls of the artery, and then a stent is placed to keep it open. And then further, the fibrinolytic agent that's given intravenously is an enzyme-based, so it breaks up the clot. And then also other medications given are opioids for pain management, and nitrates and beta blockers. Important treatment for a cardiac arrest is early intervention. So this includes cardiopulmonary resuscitation, CPR, just immediately following the collapse of the person, and also defibrillation, usually involving an AED. So because most cardiac arrests happen outside of a hospital setting, it's really important that you have bystanders trained in CPR, as well as AEDs readily available in all public spaces. So at the advanced life support level of care, patients are also intubated with endotracheal tubes and given epinephrine and other medications intravenously. But interestingly, studies have shown that there's not actually significant improvements between patients who are intubated and given medications versus those who are simply given basic life support care, which is the AED and CPR. Or the return of spontaneous circulation is achieved, there is a set of post-resuscitation care that's recommended for advanced cardiac life support. So this includes to be given IV fluids, vasopressors to increase blood pressure, and a targeted temperature management, which is used to keep the body cool and hopefully preserve brain function. Cardiac infarctions have much better prognosis than cardiac arrests. Acute MI has a mortality rate of 5 to 30%, with most deaths occurring before someone's at the hospital, because there's such advanced treatments now that typically if someone can make it to the hospital and they survive that long, there's a good chance that the medications and angioplasty will prevent them from dying. An additional 5 to 12% mortality rate in the first year following a myocardial infarction, but the best outcomes are linked to preserved left ventricular function, which makes sense given the role of the left ventricle in pumping blood to the body. So on the other hand, have a much worse prognosis, given the mortality rate being 90 to 97%. There is improved prognosis for younger people and those without comorbidities, but it's just really necessary to have early intervention with CPR and an AED to have a good outcome. Otherwise, it's a very, very low prognosis and a very high mortality rate. It's to lifestyle effects of these conditions on the body. It's just to be said that the best way of not having to have any lifestyle changes is to just use a more preventative-based method in the first place, but prior to having any of these issues, just not smoking, exercising regularly, eating a healthy diet that has a lot of vitamins in it, and avoiding being obese is just really important. But after like a myocardial infarction, these same behaviors will help prevent additional cardiac issues, including another myocardial infarction or cardiac arrest eventually. So the heart can have decreased functioning following a myocardial infarction due to the necrosis and development of scar tissue. which is what contributes to that increased mortality rate in the first year following a myocardial infarction. With cardiac arrests, the same can be said about lifestyle changes, so it's important to continue or start living a much healthier lifestyle. And in addition to that, there are mild declines in cognitive functioning following cardiac arrest if someone does achieve ROSC, but there's also a lower rate of survival over the course of 3 years following the cardiac arrest. Specific differences between a myocardial infarction and a cardiac arrest have already been discussed throughout this presentation, but the overarching similarities is that they both impact the heart, and similar lifestyle choices can lead to both these conditions, such as having coronary heart disease, which is caused by having an unhealthy diet, being obese, smoking. And they are linked, so having a heart attack does predispose someone to have a cardiac arrest later on. But the biggest difference is really how it impacts the heart. So if you think of the heart as like a house, the like a myocardial infarction is kind of like an issue with the plumbing, it's like a clogged pipe, whereas a cardiac arrest is more of an issue with electricity. So it's like if the motor of the plumbing system is broken and you can't pump anything through